My name is Aaron Zolbrod. Thanks for joining us on the Health Insurance Store podcast, where we take on the entrenched status quo of our nation's healthcare system. Our goal is to stimulate transparent conversation on everything associated with healthcare. We want to guide our listeners through a system filled with deliberate obfuscation while protecting your hard-earned money. We appreciate you being part of our initiative to bring clarity and compassion to healthcare. Let's move on to the topic of long-term care, be that nursing home or maybe in-home care. This is a major fear for my clients. They're always asking me, what do I do if we need long-term care? Does Medicare cover long-term care? Which the answer is no. And how do we prepare for this? Because other than saving $500,000 to be only used like in the event of long-term care break glass, otherwise, I don't see if there's a absolute easy answer for that. Is there?
What you're seeing from your clients is exactly right. I mean, there's a lot of apprehension about that, and understandably so, because the cost of long-term care can be dramatic. There's different types of long-term care that you see here in Pennsylvania. Assisted living facilities, personal care homes. That cost may range from a couple to several $1,000s a month, which is a lot, to skilled nursing care, which at that point you're talking $8,000 to $10,000 per month.
I mean, if you're in a nursing home, right, where you need attention from nurses, right, and those types of things, bathing, dressing, feeding, any one or all of those, my research is telling me $9,000 to $11,000 a month.
That, and for this part of the state, that's very accurate. Yeah,
that's
which is a big
crazy
chunk of money.
And also, my research said $21 an hour is the going rate for somebody to come in the home and do those things.
Yes, that's another kind of care, in-home care, but that also gets very expensive. It's nice, but
I did the math on it. $21 times round the clock is, again, $10,000 is $9,000 a month. That's $100,000 a year.
Yeah.
And that's where I'm getting the $500,000 figure. 5 years of that is $500,000.
Yeah.
So my client's biggest fear, I guess, is all of our fears is what happens when we run out of money?
And that's always a concern. So going back to the question about how do you prepare, because that's ultimately what's at the heart of all of this. There are a couple ways of trying to prepare as best you can. I mean, one of the best ways is long-term care insurance. I mean, that's one thing that's available. There are a lot of good products out there, and they're helpful to a lot of people because that will help cover or at least offset some of the costs associated with long-term care at times. I always recommend that people very closely, evaluate those policies because sometimes there is or isn't complete coverage,
right?
And it's something to take a look at.
I'm glad you mentioned that because I've been asked by lots of my clients over the years, hey, I've got this long-term care policy. It just went up in price. Can you look at it? And they bring it in, and I see they're only covered for $100 a day.
Yeah, exactly. That's
which
why
is
you really want to look
$3,000 a month.
Yeah,
they bought it 30 years ago, 25 years ago. Probably $100 a day was enough back then. When they may need the policy or get closer, it's not coming close to taking care of that if they need that nursing care or nursing, quote unquote, nursing home with nurses that are going to be there. So you're $6,000, $7,000, $8,000 short even after that policy. I mean, have you ever had situations? I looked at those, Tim, sometimes, and I said, I don't see a reason why you should pay $200 a month for this, because all it's doing is postponing you going bankrupt. So if you only had $80,000 in the bank and you had a policy that covered $3,000, well, you still owe $7,000. You've only got enough money to cover 10 months. If you didn't have the policy at all, well, you only had the money to cover 6 months.
Yeah.
So you're just postponing it. I've told my people, and the right advice. Listen, I'd rather see you enjoy the $200 that you're paying for the policy and go have some fun with it while you can enjoy it. Because again, you're postponing going broke. And I want to, again, what happens when they go broke? What happens when, because my understanding is the nursing home takes every penny of assets you have, savings, checking, investments. You've got to cash it out and give it to them. And when you run out of it, then what?
So that's where some different benefits programs come into play. And you're exactly right. So unless there's other planning that's been done to help protect and preserve some assets, a nursing home or personal care home, whatever it is that's providing the care is typically going to expect all assets to be spent down, sold, used up before they, continue to provide care.
You don't lose your house in that situation, but you have to.
Well, what happens typically, there's a couple different ways. If it's without any benefits programs involved, the nursing home would expect you to sell your house and be writing the check from the sales proceeds. But if somebody gets to the point where they've spent down everything they have on long-term care expenses and all they have left is a house, they could qualify for benefits programs in Pennsylvania. Medical assistance, also called Medicaid, is one of the biggest programs that help covers long-term care in a skilled nursing facility costs. Right. And they won't force you to sell the house at that point. But then what happens is the medical assistance program accrues a claim against that house. And when you pass away, then they're going to want that house to be sold and the proceeds go to pay that claim off.
Now, if there's anything left, does it go back to the estate? Let's say that my bill was $85,000, the house sold for $120,000. The remaining goes back to the estate?
That's correct, yeah.
Okay.
Yeah.
Can a nursing home, I'm in a nursing home that costs $10,000. I run out of my money. My house is only worth $50,000. Can they kick me out?
There are
Force me to go to a cheaper, a less expensive home where I might not get the same level of care?
It's a good question. So there are regulations in place that make it difficult, for good reason.
Yeah, absolutely.
To discharge residents that are already in a skilled nursing facility. But there are ways that nursing homes are able, and not all of them do this, but there are ways that they can navigate around those, discharging to a hospital and then having the hospital discharged to a different nursing. I mean, there are ways of doing it, but hypothetically, it is possible to discharge somebody from a nursing home after they're unable to pay. It just oftentimes takes some more time, and there's a process that they have to follow to do it correctly.
It doesn't happen that often from your experience. No. Okay, good. That's it. Now, also, when you come into that situation where you hit medical assistance, you're out of money, you've signed your house over to the state that you signed it over, not to the home, correct?
Yeah, exactly.
You sign it over to the state.
So if it's the medical assistance that somebody's getting assistance under, it basically the state starts accruing a claim against your house.
Based on what they're paying the home every month.
Exactly. So they keep track. Okay, we wrote a check out to the nursing home for X dollars. Mm-hmm. Whenever you pass away, we want paid X dollars back. And
doesn't your Social Security check then go also to the state or to the nursing home, with the exception of a few dollars?
That's right. So, and it differs based on a couple different factors. If there's a spouse that's still living in the community, is there a house during the first 6 months where there's a little bit of an offset to help maintain the house and pay some expenses associated with that? But generally, yes, that's called the patient pay liability. And that means that any income that you get, except for at this point, it's like $45 and offset for medical expenses.
To buy what? To buy toiletries, to buy shampoo, soap, toothpaste.
Yeah. That all has to go to the nursing home to help offset what the medical assistance program is covering of that cost.
And one thing I want to back up to a little bit on those long-term care policies, a lot of them only pay for like 2 years too, right?
Yeah,
so it's $100 a day, $100 a month for a period of 2 years. It's like, what did I buy this policy for?
Yeah.
And that's the danger. And people have asked me, do you sell those policies? No way. I won't touch them because we don't know in 15 years. So you come in, Tim, and you buy it. You're 30 something years old and you buy it now, and you won't need it for 40. You might need it for 40 years. We don't know. My gosh, if the price went up, 300% over the last 25, 30 years, what's it going to be in another 30? I could sell you a policy that's $300 a day that covers your $9,000, but in 40 years, it might be $800 a day it might take by then. So
that's just it. Those policies are, anybody that's looking at those would really want to closely evaluate those, because the one thing that I see is just the cost. I mean, the premiums on those long-term care policies can be pretty substantial, and they go up.
Right. That's when people contact me as, I was paying $130, it went up to $200, or I can lower my benefit down to $50 a day, $50 a day, and it's just crazy. So then what I've recommended people do is get rid of that policy, take the money you spent, go see an elder attorney, right? Go see Tim and let him, because are there ways to plan for this so we can protect some of our assets?
There are, and a lot of the planning opportunities are based on what the circumstances are at that time. So, for example, if somebody's, either in a nursing home facility already or imminently going to be into a nursing, that's what I call crisis planning. There's not a whole lot of options we have on the table.
Needs to be done earlier.
Exactly.
That's what you're saying.
Exactly.
So we have clients who are 65 years old. You can't wait till you're 80.
No.
And you've been diagnosed with dementia, or even early onset Alzheimer's. That's not when you can do it. Correct?
No, that's not the advised time to do it. You can do it, but you're taking a major risk. You just have to undo it in order to qualify for benefits later on down the road.
Because there's a look back period. To have what's called a look back period.
That's exactly
How
right.
long is that now?
That's so for the medical assistance program, which covers long-term care in a nursing facility, it's 5 years. For VA benefits, Veterans Administration, pension benefits, which also can be used to help offset the cost for long-term care expenses, it's 3 years.
Are you up on the VA, what veterans qualify for? Because I know I've met people that they qualify. I think Vietnam vets automatically qualify for I think I'm correct. Vietnam veterans automatically qualify for long-term care assistance.
There's a specific criteria for that as well, and they go through and there are a lot of offices. The local VA offices will oftentimes assist people with this, but there's they look at your assets. They look at what your income is. They look at what your long-term care expenses are. They look at service dates. And where you served, what time period you served,
and you're familiar with all that, who qualifies for what. So again, that's where dealing with somebody like Tim can be so important. So we can protect some assets.
Yes, there.
When
are
you say
ways
some access, what are we talking about? Your home,
so
number one. I'm assuming
the home is the one that I see the most questions on, because for most people, it either has the most monetary value or the most sentimental value, or both. So people do typically want to try and protect their home because that does represent something of value that they want to pass on to the next generation.
Right.
So that's the primary asset that I think people are trying to protect. In a lot of cases, somebody who comes to me and their net worth is 7 figures plus. We can protect assets, but the likelihood if they need long-term care,
it's going to drain those.
Yeah, they can. And they have the funds available there to do it. It's going to be expensive, but there's not a whole lot you can do with those sorts of situations.
Is there some things you can do? You said 7 figures. Okay, we can gift some money. We can do some of that sort of stuff that you can set up. That we can, there's so much legally that you can gift to maybe your kids before.
Yes.
This happens.
So there's gifting prior to that 5-year look back period. There's creating different types of trusts that help protect, certain assets. Typically in order to protect assets, you're giving something up. So you're either giving up some sort of benefit associated with that asset or control of the asset or both. But there are ways of protecting assets there. And that just requires a very good, in-depth, frank conversation about what people's expectations and what their needs are going to be. Because I've had people come in and, they may have several $100,000 and say, hey, we want to protect all of that. Okay, well, we can do that, but you either got to transfer it all to your kids or we've got to lock it up into a trust where you're not really going to have access to it. And, that gets people thinking, does that make sense?
Right, because what if I need access to it and never end up in a nursing home? So this is very complicated. Again, it takes, like you said, a good, frank conversation. But I think most importantly, you got to do it now.
Yeah.
You can't wait. It's like, people always think I don't have to have health insurance. And if I get sick, I can go get it. Or, I'll go get life insurance, but not till after I get sick. It doesn't work like that.
No.
You can't crash your car without insurance today and call Geico up and say, I need car insurance, but I need it covered as of 3 hours ago because I just wrecked. Geico's going to say, no, that's not how it works. You can't wait till these things happen and expect an insurance company that's for profit to just go out and lose money. And Tim, I'm sure you've seen this before. It doesn't work like that.
No, it certainly doesn't. And especially with the 5-year look back period and the 3-year look back period, one for the medical assistance, the other for the VA benefits, that also really, really complicates things and is a reason not to wait. because people may be perfectly healthy at one point, and then just in a matter of a couple years, there's a fall, there's some sort of dramatic health condition that arises. It could change very dramatically, very quickly. And, people who now think, oh, I'm fine, I'm not going to need this within the next 5 years, that could change. And the statistics about, the number of people over age 65 that do need some sort of skilled nursing care at some point is surprisingly high. Now, thankfully,
would you have a approximate figure?
Yeah, last time I had looked at it, it's about 2/3 of everybody over is going to need. Now the good thing is, for most of those people, they're fairly short stays,
right?
Just for short-term rehab.
Gotcha.
After a fall or surgery or something.
Skilled
like
nursing,
that. Exactly.
Like short-term skilled nursing, which is covered by Medicare for 100 days.
Up to the first 100 days. Right. There's some qualifiers to that.
Right, and that's not a place you're going to get quote-unquote nursing care. That's a place designed to rehab you or nurse you back to health.
Yes.
So you can go home and dress yourself, feed yourself, and bathe yourself. This is. And the reason why it's 100 days, correct me if I'm wrong, Tim, it's if you're not better after 100 days and able to do that, it's time probably for a long-term care.
That's exactly right. That's the logic with the Medicaid or Medicare program, why they'll cover up to 100 days.
I think that's pretty good logic. Do you agree?
I agree.
So don't think that that's covered. So you're saying, so I wonder what percentage of people would need care outside of a skilled facility then. I'm wondering what percentage. I mean, you said 66%. That's a huge number.
Yeah.
I wonder if you took that equation out of it, what percentage of people will end up in a nursing home, assisted living,
personal care home, or needing home care,
home health care. Yeah. And I've known people who've dealt with that round the clock home health care.
Yeah.
Which is just, again, financially draining. What would you tell? So this is where I meet people. They come in, they're married couple, turning 65 within 6 months of each other, or a year or 2 years. They don't have a will. They don't have a power. Again, I can't believe how many people don't. What advice would you give to those folks?
I mean, I think they definitely would want to sit down with an estate planning attorney and just have a conversation. Hey, what documents do I need? Does it make sense for me to have a will, power of attorney, and a healthcare power of attorney? And then start talking about those. The answer in most cases is going to be yes. And then let's figure out what works best for your specific situation.
And so let me add to that. Same married couple. They've got $400,000 in cash, liquid assets, and maybe a home worth $150,000. Again, what do we want to do? We meet them at 65. We want to do what we can to protect those. And again, people probably think, oh my gosh, it's going to cost me $10,000, $20,000, $15,000 to do that.
No.
Exactly.
Yeah, nowhere near that. I mean, planning at that level is not something that should have a price tag like that. It's not a one size fits all solution for anybody, because I've had situations where clients come in and their situation is very unique in the sense that they may have a family member who they can't rely on to gift money to and just kind of hold it there, because they may have their own issues, or may have marital issues. Or
that's the first thing I ask when somebody says something. I say, do you trust your kids?
Exactly.
And I've gotten answers from not really, or yes, or no.
Yeah. So that's one of the things that can sometimes, eliminate some options or restrict some of the things that we can do. Other times you ask, okay, what property do you have? Are you comfortable adding children to that property? Once again, how well do you trust your kids?
Right.
What are their competencies? Sometimes you can trust them, but some children are just more capable of handling, finances and record keeping. And
you never know what can happen in today's day and age with all the addiction issues we have. It's somebody's perfectly fine now, no addiction issues, and next thing you know, I mean, I hate to even discuss it, but it's the society we live in. We never know how to prepare for those things as well.
That's exactly right. And other things that you see is, sometimes children have disabilities as well. So, you have to take that into account where they can't because they're receiving some sort of benefits. So, there's some special needs planning or supplemental needs planning that has to play into their situation.
And you said it's no one size fits all. For me, for example, I said, if God forbid I pass away, my daughter's 15, I don't want to leave her a decent sized sum of money that she can just blow through before she's. I can't imagine somebody left me a couple $100,000 at age 19 or 20 or 21. Good God. Steve's over looking at me. He knows me well enough. We've only been knowing each other for 6 months, but he looks over, oh my gosh, you're crazy now. I couldn't imagine what you were like when you were 19. But so I mean, we set mine up, I believe, so Adelina couldn't get that money until she was 30, that it would be put in a trust.
That's correct, yes.
For her, and she could get money for things like, what did we say, college,
buying a house.
Down payment for a house, things of that nature. But she couldn't just say, oh, I want $150,000 because I want to take my dream vacation.
Exactly. There's some restraint there, and we put a trustee kind of in between those funds and your daughter, so it wouldn't necessarily.
And again, that's what you like about your job, because here's my needs, here's where I want it. Let's find a solution to my concerns and what you did for me. So the bottom line is, you got to call a guy like Tim. He's been helping me with all kinds of different things for. I mean, you must have just barely been out of law school and, started working up the hill when I started using you. And I trust him with, gosh, he's got with anything that I have. So I encourage everybody, if you want to, get this plan, and gosh, just if nothing else, get your will and your medical and financial power of attorney. If you do nothing else, and you can talk to him about planning on these, for your long-term care needs and protecting those assets. We work so hard all our lives to leave something for our kids or grandkids. And, it's so sad when that, wealth or that hard work is all kind of vanishes and you can't leave anything to your kids because you haven't planned. So, everybody should go and do that. Again, Timothy Witt, Watson, Mundorf, Brooks, and Sepik here in Connellsville. The phone number is 724-626-8882. And Tim's email is TWITT@WMBlaw.com. If you want to get that information, we can pass it on to you. You can call us here at the Health Insurance Store, 724-603-3403. Email me. You can go to our website at getyourbestplan.com and just request Tim's contact information if you'd like to. Tim, can you want to add anything else that maybe we haven't covered here today?
We had a great conversation. I really appreciate the opportunity. It's one of those things, like you said, and what's the old adage? An ounce of prevention is worth a pound of cure. This is one of those situations with long-term care planning, estate planning, where that's absolutely the case.
And again, to review, it's not that expensive.
No. It's very surprising sometimes how cost effective it can be.
Do you guys charge for initial consultation for something like this?
It depends on the work that comes after that, but typically, if we're doing additional work, there's no initial consultation.
So if somebody just wants to come in and discuss, hey, I think I want a power of attorney and a will, and you say, yeah, you should have one, and here's why, that doesn't cost anything. It's when you start to prepare the documents that's what they're going to pay for. And again, I was shocked how little it cost. I think I remember having that discussion with you. I can't believe this is all, I got all these documents and this is all I had to pay for it. So please, it's well worth the investment, and that's what it is. And it's really minuscule compared to what, a few months of your cell phone bill is basically what it amounts to for most of us, or even not a few months if you've got Verizon and have your kid, have your wife and your kid on the plan. Trust me, it's going to be less than a few months of your cell phone bill. So Tim, really appreciate you coming down today for our first ever
That's awesome.
First ever Health Insurance Store podcast. And just a review of what we do here at the Health Insurance Store before we sign off is, we are, the name implies what we do, health insurance. We do all things health insurance and basically nothing but health insurance, individual health insurance, Medicare, supplements, Advantage plans, and Part D, and then we do employer group plans. And, why I do the podcast is, why I wanted to do these, I want to get this information out. It's all related to what we do here. And these are questions that we're getting, and I like to bring in the experts so they can tell us, I want to pull back the curtain, man, on all this kind of stuff. You got to know how the system works if you're going to prepare for the system. And that's what we're going to continue to do here on these podcasts. So we're going to sign off for today. And thanks again, Tim.
Hey, thank you, Aaron. I appreciate it.
Thanks for listening, folks. Join us again soon as we interview those on the front lines of healthcare, health insurance, Medicare, and our ongoing prescription drug crisis. My name is Aaron Zolbrod, and we look forward to helping you get your best plan at the Health Insurance Store.